And it's time for The Clash. It's Freedom Day Eve, but for many, isolation is on the cards. A staggering 500,000 people in England were pinged by the NHS COVID-19 app in a single week. That's the highest weekly figure ever recorded. We're seeing businesses on the verge of closing due to isolating staff, hospitals cancelling operations because clinical staff are unable to come into work, and food shortages caused by a lack of delivery drivers. So is the disruption worth it, or should we all just delete the app? David Paton, Professor of Industrial Economics at Nottingham University Business School, says that the ping-demic is locked down by the back door. Hugh, Osmond, the founder of Taverns, is calling for those pinged on the NHS app to be allowed to go back to work if they get a PCR test that is negative. However, Dr. David Strain, senior clinical lecturer at the University of Exeter Medical School, claims that the app has saved 600,000 lives and that we must not lose faith in it. They all join me now. David Paton, great to have you here. Why do you think that this is locked down by the back door?
Well, it's not just the NHS app, which, as you say, we've had 500,000 contacts in that first week. It's also the broader test and trace problem. Actually, it's 1.6 million contacts, including school children who are told to isolate. Now, actually, the NHS app, it's not a legal requirement to isolate, but it's people have that understanding. With other contacts, when you're contacted directly by the NHS, it is. And the problem is that the system is just really broken down. It's unsustainable. And the collateral damage is absolutely huge. And like many government policies, there seems to be a lack of willingness to take into account both the costs as well as any benefits there may be. And the costs here are really huge, not just of running the programme, but the hundreds of thousands of young people missing school, the businesses that are on the edge anyway that may end up being shut down, hospitals that could find it difficult to operate because so many of their staff are off. And I think we're now at the stage, things may have been different a year ago, but we're now at the stage where we need a completely different approach. And we shouldn't be telling people that they have to isolate. People may well want to know if they've been close to somebody who has had COVID, but much better to give them that information and let them take the decisions themselves, rather than going down this route we are now, where they're sort of being forced into 10-day isolation when the vast majority, perhaps 90% of that 1.6 million people will not test positive, will be fit, will be healthy, and will not have COVID. It's a really out of proportion response.
Is Hugh Osmond with us? Hugh, can you hear me?
Hear me?
Yes, we've got you now, Hugh. So tell me about the devastating real-world impact that this is having on the hospitality industry.
Well, it gets pretty crazy. We had one venue where we had 26 people pinged. It was actually a venue where we were training up new staff, so it's unusual to have that many people together, but 26 different people got pinged, and so we had to delay the opening. And that's happening throughout the industry. People coming in and out of hospitality, clearly the opportunity for staff to get pinged, whether or not they're actually likely to have had any chance of getting infected, it's absolutely massive. So it is causing chaos. And you can see up and down the country now, all over Cornwall, where I was just recently, you see restaurants, bars and everything with notices on the door saying, sorry, we've had to close because of these pings and this ping-demic. And I think that, there are various points here because, one, it's incredibly disruptive, and people may say, well, hospitality is not essential, but we know it's having an even worse effect on the NHS, critical food supplies, deliveries and so forth. But the second thing is, what is it for? What is it for? All those who are vulnerable have been offered the vaccine. That's all of them. And we know that in the over 50s, it's a very high, 95% take up. The ONS figures saying 98% plus of the over 50s now have antibodies. So what is this test and trace for, even assuming that it worked? Which of course,
let's put that question to Dr. David Strain. So, Dr. Strain, you're a senior clinical lecturer at the University of Exeter Medical School. you want people to keep using this app. You have heard about the real world problems it's causing. You've heard about why people are deleting it. So why should people not delete it given that scenario?
Yeah, thanks. So can I just start off by correcting one of those in the headlines? It's 600,000 cases of COVID that the app has prevented. About 60,000 cases of long COVID it's prevented, and about 8,000 deaths that the app has prevented. And the reason that it's going ping-demic mad is not because of the app. The reason it's going mad is because cases are rising that much. The new variant of COVID is affecting younger adults, a group that wasn't affected by the alpha variant or the wild type variant. And this is the smartphone generation. These are the people who are carrying the app around, and these are the people that are having contact and potentially spreading it. Now, to put things into context, I accept that the app is not perfect. There are some times that the app should be taken as a guide. So, for example, with all our healthcare workers, we ask them to switch off the Bluetooth as soon as they put the face mask on and the shield, the protective goggles. Because actually, if you are protected, you will come into contact with COVID, but then it's a much lesser risk. And I would expect exactly the same for the staff at the Punch Taverns, for example, that when they have their masks on and they're behind a Perspex shield that have been so well put up to protect the staff, then they have a very low risk of either catching it from the customers or from their work colleagues.
Okay,
but at this moment in time,
why should people have to stay locked away if they have had a negative PCR test? You say that's the gold standard. Surely we need to have some form of common sense where at the very least people who we can say provably don't have COVID can be out in the world, especially, by the way, when they're a junior doctor or they work in the armed services, or, to refer it to today's news, if you're the damn Prime Minister or the Chancellor of the Exchequer trying to get this country back on its feet.
So the reasons behind that are quite simple. That firstly, the PCR only becomes positive at about 5 days after you've come into contact with COVID. That's the average. In some patients, it's up to 7 to 10 days. And they are still potentially spreading the virus between day 3 and day 5 on the day that they become positive. So we could actually see going forward a point where if you are pinged, if you test negative at day 5 and day 7, that would be a good time to consider releasing, but that's going forward. It's important to say that the Pfizer vaccine only stops you catching the new variant of COVID by about 64%. And as this variant can infect 7 other people, that means that even if you are fully vaccinated, 2 out of the 7 that otherwise would have caught it can still potentially catch it, unless they're protected by the masks and the face shields lab. And the most important thing for the younger adults is, as your previous guest already said, it's not the risk of dying, it's not the risk of going to ITU, it's the fact that 1 in 10 who catches COVID will end up with long COVID. They'll be in a position where they cannot work for at least the next 3 months. We don't know how long it lasts, but the estimate at the moment from the Office of National Statistics suggests that around 6% of people who catch COVID are still unable to function properly 12 months later. Now, for a younger generation that we are dependent on to get the economy going, we're dependent on to be in the studies, to being the future world leaders, this is a generation that cannot afford to be off their game for 12 months. And one of the biggest predictors of those getting long COVID are those who work through the early phases of the disease. So therefore, the app is your best way of protecting you and the people around you.
So, Professor Paton, you have Dr. Strain there saying, look, this is about long COVID. To me, it sounds like we're not getting anywhere near normality while this app is still operating. But how do you respond to that specific point about this could prevent long COVID in young people?
Well, we come back to the issue of how effective the app is actually at preventing infection in itself. Of course, when people are deleting the app at the rates we've had, people are voting with their feet. 20%, 30% of young people have already deleted the app. I think the system is breaking down, so it's rather a moot point. But I think going back to about whether the app has saved that many lives. It's very uncertain, actually, because we don't know what would have happened without the app. Even without the app, some people will still get informed if they've been in close contact. People who get COVID test positive do tend to want to tell their friends and contacts, irrespective of the app. But the difference now, of course, is that 6 months, a year ago, people were dying at a much higher rate after contracting COVID. So at the moment, we have as many cases, positive tests, as we did back in late December. But in late December, there were about 400 people dying per day on average, whereas now the number of deaths per day around about 30. So we're in a very different context. So the likelihood of the app saving lives now is much, much lower. And we then cannot separate it from the huge, huge costs that are being imposed. And there's an interesting study from the Royal Society just earlier this month, just a few days ago, suggesting that when you have a system which is backed by, where people have to isolate, backed by criminal law. If they don't, it's a criminal offence, which, as I said, isn't the case with the app, but is with the rest of the test and trace system. You actually end up with a worse outcome because people tend not to engage. So the worse the consequences are when you know you have to isolate for 10 days, you're not even allowed to go out for an exercise, and you're stuck in a flat, say, for 10 days solid, you're much less likely to engage with the system. So a rethink of the system where people aren't told to isolate for 10 days, they're given the information perhaps about they've been in contact with somebody who's had COVID, which may be very welcome, and people will use that depending on their circumstance. So if they're close to a vulnerable person, they may react very differently to if they're living on their own or in a student house. And I think we need to start trusting people a little bit more, have trust in the fact that the vulnerable have been vaccinated, and we should go in the same direction that the government talked about in terms of giving people responsibility and trusting them, as is happening at midnight today in some issues. That needs to be extended to the test and trace system.
We should trust people more. And Hugh, Osmond, this is imperative for business, isn't it? Because I keep hearing of restaurants and nightclubs that are simply not going to be able to open because their staff numbers have been wiped out as a result of the ping-demic.
Yes, absolutely. And these are young people who are actually not affected badly by COVID. I have to take serious issue with Dr. Strain in that the only empirical control match study in the world, or by far the largest in the world, which was reported in the British Medical Journal, huge study from the US, 300,000, monitoring 300,000 cases of COVID, following COVID. And it found that actually when you control match it against people who from previous years, 2019, 2020, and those who've suffered other respiratory infections, there was virtually no greater instance of post-COVID viral syndrome than there was for other similar lower respiratory tract infections, and particularly in young people, very, very low instance when you control match it. And in fact, there's a study in Switzerland, and it found that those who had been seropositive for COVID suffered actually no higher instance of symptoms than those who had not been seropositive at any stage. That's a study, again, a large study, thousands of young people studied like this. So if you simply take a symptom reporting app or some such, and you monitor that and you don't control it against people who haven't had it, you can come up with these very alarming figures. But the properly reported studies, properly conducted against large samples with proper controls, and say reported in the British Medical Journal, so not some local.
Well, look, it's fascinating stuff, and unfortunately,
we don't get long COVID in young people to any great extent.
Well, exactly. I think there's a lot about long COVID we still don't know, and I think there is a lot of hysteria going on. Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.